to remove the root piece. Suppose normally what will happen in orthodontic extraction, removing a premolar, maxillary first premolars. So maxillary first premolars will have a slender roots. So one will be a buccal root, another one will be a lingual root. Sometimes the root can be a fused roots, a conical root can be. Most of the time it will be a buccal and lingual root. So if you are trying to luxate, when you are trying to remove it, one of the root can get fractured. So when it is fractured, so it is, if it is a apical third fracture less than 5 mm or 3 to 5 mm size, we can very well leave it. But if an orthodontic prefers that it has to be removed, then you have to do kind of remove. So once if the root is present over there, either you access the tooth and a direct vision you try to remove it. There are certain simple instruments, simple techniques which can help you in removing the fractured root. So first thing is that you luxate well. So that is a very, very important thing, luxation of the root. So once you luxate any fractured root, if it is loose in the socket, it can easily come. Then you giving a fine, immediately giving a fractional force. So once it is fractured at the cervical level, you identify the orifice of the canals. So in orthodontic extraction, you should always preserve the buccal bone. So you try to remove the root. So you identify the canals. So maybe you can use an endophiles. Endophiles are many times it comes in handy. So you use an endo instruments and just access into the canal orifice and nicely hold it and just give a gentle pull out, it can come off. That is sometimes if the root is loose in the socket. Or we can raise a buccal flap. You raise a buccal flap. So you should always preserve the crestal bone. In an orthodontic treatment, crestal bone should always be preserved. So make an apical window above the root apice and try to push the tooth out. Then also you can easily remove. So you should handle the patients carefully, and it is much easy to do if you know the technique.